Hello everyone. This is assessing part 2. It is a part of topic 1. So we're now on lesson 2.1. So what are the learning outcomes for today? You should be able to list the models on how to organize data, give examples of the organization models, and you will learn to how to validate data, enumerate the benefits of validation of data, differentiate between cues and inferences, and list guidelines in validating data, and then later on give examples of correct documentation of data. Okay, so if you remember the mnemonics for assessment, we have the COVD, the COVD. So right now we're on organizing data. So it is the systematic organization of data. So also known as the nursing health history, nursing assessment, or nursing data form. So organization of data can be done using any of the three models. So we have the conceptual models, wellness, and non-nursing model. So let's begin. What are conceptual models? So conceptual models are based on nursing models or the nursing framework. Examples are we have the Gordon's, Orem's, and the Royce adaptation model. So Gordon involves 11 functional health patterns. So by using Gordon's as a guide in organization of data, the nurse collects this functional and functional behavior of the client. Okay, so example here you see elimination. So you will identify by asking your client about his voiding habits. So let's say you ask the client, how often do you void or urinate in a day? Okay. So on the next slide, you will see this is available and you can see this in the Cozier. These are the information gathered by the nurse for patient Margaret, and the information are organized according to the functional health patterns. So let's go directly to elimination. So in elimination, the client states that there is no problem. However, the client responded that there is a decrease in urinary frequency and the amount of the urine for a couple of days. Then Margaret also stated that her last bowel movement was yesterday and the stool was formed, so it was normal then. Okay. So that's for functional health pattern. So you will see all the information are organized, they are clustered according to each 11 functional patterns by Gordon. Okay, so next, this is an example of a form which can help you obtain concise and complete data. So as you see, it is organized according to body system, respiratory system, neurological system, the muscle, and the GI system. Also, in this form, nursing concerns are also included, such as screening screening a client for a risk for fall, and if the client has any history of allergies, they are also included in this form. Okay. Okay, so this is still part of the previous form, and as you can see, the nurse is documenting subjective data from the client. So the subjective data, okay, it is in a narrative form. Client complains of pain when coughing, and the client mentions that coughing is relieved when she sits up, and there's a nausea with coughing. Okay, so this, the subjective data or the verbalization of the client are organized in this part of the form. Next. Okay, so this is Sister Callista Roy's adaptation model. So information are grouped into 4 categories. So knowing adaptive responses of the client, for example, and elimination, you question the client of how does your client increase his fluid intake in case your client notices that his urine output is decreasing. So it's more of knowing from your client how do they respond or how do they react should crisis or should problem arise. Now, this is an example of a nursing assessment form for the ICU, mostly requiring the nurse to put a check mark for any patient finding. So let's try this one. Let's say you after your assessment, you identified that the client has a intact oral mucosa, there are no cracks in the lips, and the client is able to cough spontaneously and so on. Okay, so next type of models in organizing data is the wellness models. So wellness models can assist clients to identify health risks and explore habits. Wellness models generally include the following aspects as shown here on the right. So examples are health history, physical fitness evaluation, and nutritional assessment. Okay. Lastly, the non-nursing models. So examples are body systems model, Maslow's, and developmental theories. So examples of body system is organizing information according to body system, for example, like the respiratory system, cardiovascular system, and so on. Okay, that should be very simple. So now this is the last part of okay. We are on the second to the last part, by the way. So, we have the COVD validating data. So, we already collected the data, we organized the data, and now you have all the data organized. Let's say you're using the body system, you organize them based on according to cardiovascular system, respiratory system, and now it's time for us to validate the data. Okay, so information gathered must be complete, factual, and accurate because nursing diagnosis and interventions are based on this information. Always remember, you need to have the correct, complete, and accurate subjective and objective data because in the next lesson we will be discussing nursing diagnosis, and it is a requirement that you have the correct information, you have the needed data for you to come up with a nursing with a correct nursing diagnosis. Okay, so what is validation? Validation is double checking or verifying to confirm if an information is factual and accurate. Factual if it is really happening and not your interpretation. Accurate if it is exact, and for example, that is when you measure the height or the weight of your client, not your assumption. Okay, so what are the benefits of validating data? So first is if you validate the data, it helps you ensure that you have the complete information at hand, and also it helps you ensure that your subjective and objective data agree, and also to obtain overlooked information, or when you validate the data, it help you identify that you missed something. So it is a time for you to obtain or to gather any information that you have missed. Okay. Now another advantages of validating data is you will be able to differentiate between cues and inferences. So what are cues and inferences? Cues are the subjective and the objective data. You always remember that anything that is stated or verbalized by your client, they are your subjective data, also known as cues. So they are the same. Do not confuse yourself. Subjective cues and subjective data are the same. And next, cues are objective cues. So anything that you see, anything that you observe from your client using your senses. Okay, so that's the objective data or the objective cues. And what is an inference? So inferences are the nurse's interpretation or conclusions based on the cues. Okay, let's have an example on the next slide. Here, okay, now we have an incision here, and it has been sutured already. We don't know how many days already. So now, so let's identify what are the cues here. Okay, so I'll give you a few seconds to make your objective cues or objective data of the picture. Okay, right? So as you can see, it is reddish, and yeah, there might be a discharge or a pus coming out of the incision. So here's an example of a objective cue done by the nurse or the observer. So incision is red, hot, and swollen. So it is reddish. And basically, if you have an incision that looks like this, when you palpate it, it will be warm, and then it is swollen, namamaga. Okay, so what will be the inference of the nurse? Infected incision site. Right? Okay, now always remember, while you are doing the assessment, if you need to validate the data, all you need for your assessment, whether it's subjective or objective, you only need the cues. You just describe it, but you should avoid doing inferences. Okay, you do not interpret why the incision is red, why the incision is swollen. You do not make an assumption, you do not make an interpretation. However, you will need your inferences when you make your nursing diagnosis later on. Okay? Yeah, good. Okay. Now, not all data should be validated. For example, the height of the client, the weight of the client, or let's say the lab result, the urine analysis. Okay, so not all of the data needs to be validated. So validate when there are discrepancies between the data. Discrepancy is a lack of compatibility between the facts or between your data. Okay, next, avoid assumptions, avoid assuming things, or you need to validate assumption. Okay, you should avoid assuming things towards your client. Okay, for example, what do you see here is we have the client, we have the President Trump. He's actually holding his arms, or he has his arms across his chest. Okay, so you might assume as a nurse that Mr. Trump is having chest pain. However, that is only your assumption. Okay, so what is your assumption? That Mr. Trump is having a chest pain. Now, you need to validate your assumption by asking Mr. Trump, Mr. Trump, why are you holding your arms, or why do you have why do you put your arms across your chest? And Mr. Trump tells you, yes, because my right hand is hurting. Maybe because of for example, he has a inflammation of the joints of his hands. Okay, therefore, you avoid making assumptions, or you might need to validate your assumptions by asking your client. Okay, now here are the guidelines in validating assessment data. So let's start with the first one. You need to compare subjective and objective data to verify the client's statement with your observation, just like what we did a while ago with Mr. Trump. Okay, so here's an example. So the client would tell you that, oh, I feel hot. So you need to compare the feeling of client with a measurement of the body temperature. So you need to compare subjective and objective data. Another example, if your client tells you that I think I'm having a decreased amount of urine, so you cannot immediately document that, or tell your staff nurses or tell your clinical instructor that the client is having oliguria. However, to validate the data, then you need to measure the urine, monitor the urine output, and then measure them. Therefore, ideally, you will tell your CI that your client has oliguria after measuring the urine output of the client. You do not rely on the client's statement. Clear? Okay. Now, next is you need to clarify any ambiguous or vague statements. So that would mean you need to clarify any unclear statement or statement with double meaning or any statement that has uncertainty. Okay, for example, the client tells you, I've been feeling sick on and off for 6 weeks. Okay, so as a nurse, you'll ask the client or instruct the client, describe what your sickness is like. Tell me what you mean by on and off. Okay. Now, be sure your data consists of cues and not inferences. Always do that when you make your assessment. Your data should contain cues or the subjective cues and the objective cues and not inferences. Okay, for example, the observation of the nurse that the client using the sense of sight, the nurse sees that the client has a dry skin and reduced tissue turgor or the elasticity of the skin. So what can be an inference of the client? It's dehydration, right? But for your assessment, you do not write down dehydration, but you write down as a part of your objective data, dry skin and reduced tissue turgor or elasticity of the skin and so on. Okay, double check data that are extremely abnormal. For example, if you are taking care of a client from 7 a.m., then suddenly at 12 noon, your client becomes hypertensive with a blood pressure of 180 over 100 millimeter of mercury. That's quite high. So you need to double check by using a different sphygmomanometer or by taking the blood pressure of your client using the other arm of your client. Okay, clear? Okay. Next is determine the presence of factor that may interfere with accurate measurement. For example, it is expected that you will have a high respiratory rate result if you count the respiratory rate of a crying infant, right? Okay, so you might need to count the RR again when the client is asleep or the client is not crying. Okay, so that's for validation of data. Next, we document the data. So it should be just a short, there should be an accurate documentation, and always remember, documenting of data, it should be factual, based on facts, based on truth, based on accuracy, and documentation of data must not be an interpretation by the nurse, or they must not be your interpretation. Okay. Now here's an example of documenting data. Okay. Now here is the correct methods of recording the intake of clients or the breakfast intake. Okay, the client would tell you, maganda naman, may gana akong kumain. So it is incorrect in your if you write down in your assessment that you noted a good appetite, or if you write down normal appetite. You must avoid the following, okay, because they are what? Yes, they are inferences, or your inference. Okay, sorry about that. Okay. So instead of noting that the client has a good appetite, what you can actually do is record the client's breakfast intake. That will be our objective data. For example, coffee of 240 ml, juice of 120 ml, 1 egg, and 1 slice of toast or 1 slice of bread. Okay. Then, to increase accuracy, the nurse may also record subjective data using the statement of the client. Let's say, sabi ng client, may gana akong kumain. So, you will have two types of data for the client. We have the subjective data here, and you have your objective data here. Clear? Okay. Now, let's go back to Linda again. Okay. Now, Linda Evangelista, she's taking care of Kate Moss. Okay. Now, let's go back. So, Kate is voiding on the bedside commode. Linda sees the patient making a grimace face. And also, after voiding, Linda measures the urine with an output of 80 ml and the color was dark amber. So the question is, which of the following documentation by the nurse is inappropriate? Formulate your answer. Okay, so now let's begin before we identify the correct answer, let's begin first by taking out the correct documentation by the nurse. Let's start with letter A. Facial grimace noted while voiding. Did it happen? Did the nurse observe it? Yes. Okay. So we have facial grimace. Okay. Next is urine output of 80 ml noted. Okay. Yes. It is here. Okay, next. Dark amber color urine. Did the nurse observe it? Yes. Dark amber urine. Okay, now let's identify. Is facial grimace subjective or objective? It is objective, yes, because Using your sense of sight, you see the patient making a grimace face. What about the urine output of 80 ml? Is it subjective or objective? Objective, yes, because you measure it. And next we have the dark amber urine. Is it subjective or objective? Yes, it is also objective because using your sense of sight, you see the color of the urine. Okay, now let's go back to the question. Which of the following documentation by the nurse or by the student nurse is inappropriate? Or which of the following documentation is wrong? Yes, the answer should be patient in pain. Why patient is in pain is incorrect or inappropriate? Can you consider it as a subjective or objective data? Okay, first, patient in pain, it was never mentioned in this situation. The client or Kate did not tell Linda that I am in pain, right? Okay, so patient in pain, because of facial grimace, the nurse is making an assumption that the patient is in pain. Therefore, patient in pain while voiding is an example of an inference. Okay, next. Okay, now next I'm taking this is from one of the question in the remedial quiz. So let's start with this one. So you monitor the urine output of patient X from 7 a.m. to 10 a.m. The following are the volume of the urine output. So we have 8 a.m. 25 ml, 9 a.m. 20 ml, 18 ml for 10 a.m. By the way, urine output Q1H or urine output every 1 hour. So you need to measure the urine output of the client every hour. So in your nursing care plan, where will you write the urine output volume? Subjective, objective, diagnosis, or planning? Yes, the answer is objective data. Okay. Next. Okay. While the client is voiding, you see her grimace face. Habang umiihi yung client, the client states, sabi ng client, it is so painful when I void. So, is it subjective or objective? The statement of the client. Yes, it is subjective. Any statement, any report or verbalization made by the client, they are subjective cues. Next, while the client is voiding, it's the same statement. The client states that it is so painful when I void. Okay, so the nurse notes grimace face noted. Because the nurse sees the client making a grimace face. So, where will you put grimace face? Would it be subjective or objective? Yes, it is objective because the nurse observed the client making a grimace face. Okay. Okay, that's it, and that's in lesson 2.1. Thank you.